doctor actually looked me dead in the eye and said, "This is idiopathic," meaning I'm an idiot or you're pathetic.
One time, my GYN told me my pelvic ultrasound was unremarkable. And I was like, so what? You think I'm a basic bitch? It turns out, when I looked up the report, I actually have a retroverted uterus. And I was thinking, so you mean that my womb is also looking back at my 20s? Like, ugh, those were the years. In the end, they diagnosed me with something that doesn't always show up on ultrasound, endometriosis. I was like, so basically my reproductive system wants to end me. Apparently, this might all be related to something I already knew I had, irritable bowel syndrome, which essentially means that I can't stomach anyone's crap anymore. But truly, the last straw was when they said, and you might have POT syndrome. And I was like, I'm not a POT, I'm a person. I'm sorry, I just had to make a joke because, clearly this person on this podcast knows what idiopathic means. She could easily Google it, but she decided to instead make it a point to put down medical professionals that use this term to describe when things are unexplained. I will say as a fertility expert that the diagnosis or lack thereof of unexplained infertility often gets a bad rap, but it is valid. Up to 1 in 4 couples will be affected, and while it's so common, it's one of the most frustrating things that I have to tell people, because let's be honest, when you've been trying for 6 months to a year and had no luck, the last thing you want to be told after doing all of the workup, all of the testing that you're asked to do is, we don't have an answer, everything looks normal. So this is a diagnosis we give if we've done the full fertility workup and we don't see any obvious red flags. Ovulation's happening, the hormone levels are all within normal range, the uterus and the fallopian tubes look clear, the sperm checks out, or at least it's good enough that it shouldn't be a major barrier, and still not pregnant. So why in these scenarios is it not working? What are we missing? And are you being dismissed? Well, listen, the diagnosis of unexplained infertility doesn't necessarily mean that your doctor isn't looking hard enough. It means that with all of the best tools that we have at our disposal, we're not always going to be able to see the barriers that can exist. We can't measure directly egg quality on any individual. That's a major blind spot. And we don't really have a great test to understand how sperm and egg interact with each other. We don't have good ways of predicting everything there is to know about what allows an embryo to implant beyond making sure that the inner cavity is nice and smooth. And yes, sometimes there is more to uncover. Sometimes these cases, especially when I see them as second opinions, I'm picking up that there might be subtle endometriosis, there could be inflammation, metabolic imbalances, or uncontrolled chronic medical conditions that could be contributing. So I am not against ever getting a second opinion and looking for more answers, but at times there's really no hidden cause. The truth is that human reproduction at baseline is wildly inefficient. Even in your 20s, with the perfect timing, everything looks perfect on testing, the chance of a conception on a month-to-month basis is about 15 to 20%. And that number decreases with age. So if all of your test results come back normal and you're still not pregnant, the problem might simply be biology and the inefficiency of human reproduction. The moment you're handed that unexplained label, it's almost like the algorithm knows, and suddenly you see influencers that peddle fertility myths and coaches and supplement pushers coming out of the woodwork, all of whom seem to have the answer. But here's the uncomfortable truth. They don't have secret information that we somehow all missed in our medical training. They're just not bound by science or ethics, and they can sell you whatever they want. They can say whatever it takes to make you doubt your care team and reach for your wallet. Don't feel disheartened if you have an unexplained infertility diagnosis. This doesn't mean we say, good luck, keep trying on your own. Doesn't mean we don't do anything. We will move forward with treatments like medicated IUI or IVF, even without a clear defined issue or target to treat, because sometimes the thing that we're treating is the randomness, the inefficiency, the lack of control over whether every single step that's supposed to happen from fertilization to implantation will actually line up in your favor. If you've been frustrated by this diagnosis, know you're not crazy for wanting more answers, and you definitely deserve to explore every option. But don't let the absence of a clear target to treat convince you that you're broken, that your medical team has failed you. Sometimes the more honest answer is we don't know yet, and in the meantime, we can still take action. I always tell patients who are going through IVF in particular, when someone goes through a first IVF cycle, it's not only therapeutic, it's also diagnostic, because that can be sometimes the first time we get rare insight into the biology and what's happening at every step of the way. So yes, I hope this helps. Idiopathic does not mean we're all idiots. It just means that we're moving forward with a plan without a specific target to treat, and that can be okay.